Hello, everyone, and a very warm welcome to our another live webinar, How to Grow Funding and Service More Clients. For this webinar, myself, Ray Sabharwal, will be your host. And on our panel today, we have Greg Stanley-Horn, one of the founders of Athena Software, and our chief evangelist. And with him, we have Jordan Fox, who's leading the team of Penelope Experts, the SaaS-based case management platform from Athena Software. So in the next 20 to 30 minutes, or I would say 30 to 45 minutes, we will discuss a few things like how technology can help your organization obtain funding. Do you need a CRM, an EMR, or EHR solution, or do you require a case management platform? Should you build or buy that platform? And last but not the least, why are some of the first steps are so critical to that adoption of technology? Again, this would be an unscripted video discussion without any PowerPoint slides. And if you have any questions throughout the duration of the webinar, please send us through the webinar chat. Jordan will be monitoring those questions, and he will pop up those questions throughout the discussion as and when we receive them. So before we proceed, I'll let Greg and Jordan introduce themselves a little more in detail than what I said and make it easier for you to match the name to the face, although they already waved up to you. So Greg, do you want to lead up?
Sure, thanks. This is my first webinar, so go easy on me. I hope I do all right in this context. I'm the Chief Revenue Officer here at Athena, and I'm responsible for mostly all client-facing services. So the professional services, sales, services that relate to technical support, and then ongoing success as well, including the customer experience. So I've been here at Athena for about 20 years, and before that, I worked at different roles in the industry as a health services consultant. I wrote a lot of grants, designed a lot of programs, did a lot of program evaluation, and I did a lot of frontline work as well with youth and at-risk youth and different diversion programs when I was younger.
Great, and my name's Jordan Fox, and I've been at Athena for a quarter of the years that Greg has, so just over 5 years. And as Ray mentioned, lead the team of Penelope Experts at Athena, who basically are the first door from a prospective agency who's evaluating our solution, Penelope. And our job is really to gather a deep understanding of how a prospective organization is working today from a business standpoint, how their processes work, and to sort of put that process down on a table and see where there are inefficiencies, if any. And our tool, which we're serving, is Penelope, and seeing where Penelope can help and sort of reduce those inefficiencies and provide efficiencies that maybe aren't even being discussed right now. So in a nutshell, that's my role here and the entire team that I work with. And happy to be here. Definitely not my first webinar, but I'm happy to be here.
Yeah, thank you, both of you. I really respect that and appreciate you giving me the time. So you know what, Jordan and Greg, digital transformation and innovation have introduced new working environments and service delivery options. And most recently, the COVID-19 pandemic has led to changed rules of engagement. And many nonprofit organizations and social service agencies have either already seen a shift or will soon start feeling the impact of this new normal. So Greg, let me start with you. Based on your experience of the industry and the knowledge of the landscape, what do you think is the new normal now?
Well, in the immediate term, there's obviously it's requiring a lot of changes in terms of how staff interact with each other, sort of at the sort of administrative and organizational level, just to maintain a continuity of information flow and the policies and procedures that they have in place at the time. Clearly that requires a technological infrastructure to be able to provide any kind of compliance or collaboration framework for that. In addition to that, you have to layer on, okay, now they have to find different ways to provide continuity of services for their clients. Wherever there's community-based or home-based services or face-to-face services, they have to be dealt with in terms of providing other pathways to provide those services. So there's video counseling, e-chat. There's other kind of modes of direct client engagement to get them to be able to continue providing those services in a kind of remote setting.
Mm-hmm.
So I think there's that administrative layer that's really challenging, that involves collaboration, ensuring sort of a regular flow of information and accountability. There's the changing of the way services are delivered.
Mm-hmm.
There's been a lot of disruption around whether these new modalities would receive the same level of funding where possible. So, for example, maternal health, for example, would video home visiting be supported in the same way that in-person home visiting would be made? And so I think there's varying degrees of success and progress to support funding changes to support the new kind of realities on the ground that agencies are experiencing. There's been obviously a lot of pressure on cost because a lot of the stimulus is going towards the sort of organizations, companies as employees, but not so much serving the pent-up demand that's also being emerging through the COVID experience as well. So it's a hefty set of challenges. So agencies that were, I think, cash constrained or struggling with sort of to meet day to day, they're under immense pressure right now to be able to maintain operations maintain service continuity and also maintain the staff that they have in place.
Wow. So it is certainly, a very different new normal. So Jordan, what are you hearing from the agencies and the organizations during your conversations with within the industry?
I would say, I would think two things come to top of mind for me. The first is, a shift that we've always encouraged, and that's to start looking at technology less as a cost center and more as a cost saver, which when good technology is used appropriately, that's what it becomes. And if you're making an accurate business case for a technological solution being implemented, there's efficiencies that can be brought up to the surface, and those are the efficiencies that should be brought up to the surface when you're, presenting this to your board or your stakeholders or your internal group to say, why bother adopting a new system? Because any kind of change management is disruptive, but when done in the right way, I think that it becomes a cost saver in a lot of different areas. And that's part of our jobs at Athena, is to show organizations where those cost savings can come from when used appropriately, when the system's used appropriately. And we wouldn't say this applies to everybody. So that's, that's the other part of our job, is evaluating if an organization is a fit. Because if you aren't a fit and you don't realize efficiencies, then our relationship's going to be pretty short. But if you're using the system appropriately, it becomes a long-term relationship. And for those who don't know, we offer a SaaS solution. So SaaS means you have to renew that relationship. And every time you renew the relationship, you're renewing those efficiencies. You're saying that, yes, this is providing me benefit and I'm renewing that, which is a big shift from what it used to be when software was purchased and you owned it. And then it was, it might have worked for me in year one, but now it doesn't really work for me, but I own it, so I'm stuck with it. That's not the case anymore. The other thing I would say is with the rise of, because what COVID has done is propelled a lot of industries forward in terms of the innovation curve. And it's not just social services that have said, now we're 2 years down the roadmap and adopting technology. It's all kinds of spaces. Education's another good example of, students having to go online regardless of sort of the level of education. And with the sudden rise of innovation and technological adoption, we've also seen a rise in cyber attacks and sort of people preying on vulnerable organizations and associations who are suddenly moving a lot of delicate data online. And we don't want to sort of talk about this as like a fear tactic, as a reason to adopt software, but it's the reality. And we see news headlines coming out every week of organizations who've been hit by it. And the organizations that we partner with have some very, highly private and delicate data being stored. And
Yeah.
so organizations should put that at the top of their list, saying, sure, usability, efficiencies are all those things that we should be looking at, but the other side is the security, the privacy and confidentiality needs to be, top tier.
Of course, and I think with especially with social services and nonprofit sectors, the PHI part of the information piece also comes certain nuances about compliance, not only the organizational level compliance, but also the PIPEDAs and the other requirements that you need to adhere to. I think that's part of the game with anything related to software as a service component. So, which is a great part. Good discussion. We can actually talk about that, somewhere down the conversation. But I was more, thinking of keeping it on the fact what Greg mentioned in his narrative about, if the funding might dry, deteriorate, or get stagnant for some segments, in those scenarios, Greg, what are the options for these organizations? As you were pointing out, for in the new normal, some organizations might see, some have already seen. So in those instances, what are the options available for these organizations?
Well, I think what Jordan mentioned about the innovation that's being unleashed by the disruption that's occurring, and where the lesser evil was the disruption caused by change management. I think that's gone. Like this is like a serious game-changing situation for a lot of organizations. I think there's the fundamental first thing is we have to have a sense of entrepreneurship. Organizations, whenever traditional funding sources dry up, they have to seek other sources if they want to sort of continue operations. A lot of time that it's a long-term process to build those partners up, but a good part of it is sort of demonstrating you're a safe pair of hands, demonstrating the need from a data-driven perspective that you're seeing, demonstrating the visibility that you're seeing, or making visible and a compelling case around the trends that you're seeing over time, the populations that are need to be served, but also that you're doing everything you can right now to service that need, and there's a gap between sort of what you have and then what you want to try to achieve in terms of not only the outcomes that you're trying to achieve with your customers or clients, but also the resources available to do that. So entrepreneurship is making your case as an organization, making a compelling case. And so a lot of the parts, or a lot of the aspects that technology sort of contributes to really are essential to support that. These are often when your traditional sources dry up, you're forced to engage with new ones, and they don't know you. So I think having a really robust, comprehensive, sort of data-driven business case around what you're seeing, what you're asking for, and what you're going to try to do, and also a pathway to be able to demonstrate that their money's going to the intentions that they directed it is not only nice to have, it's absolutely essential. So that's one part. I think another part is that whenever there's disruption in an industry, and one of the ones we've seen that's just been accelerated by COVID is a movement to sort of client-directed funding, where clients can take their funding wherever they need to, and it's not funded directly to the organization or FTEs or things like that. So package funding that allows an individual to be able to direct it to service. That really puts the onus on organizations to provide good service and a good experience to those clients that they're working with and the stakeholders that they're working with. These kinds of things are I think radically different. It's a radical change, I think, to for social services, where in the past they were relatively passive in the sense of recipients of funding, but now they need to be really, really aggressive in sort of not only providing value for money to the stakeholders who fund them, but providing a really, really top-notch experience to the clients that they're working with and the communities that they're engaged with to try to demonstrate value and a good experience for them. Those would be two really important things, I think,
and that is akin to what most of the professionals who are currently employed in the corporate universe, they have their benefit plan. It's akin to you have that benefit plan and you can choose the provider that you want to use. Is that what you were trying to say?
Yep.
Is it
Yeah.
a good analogy?
Yep. Absolutely. Yeah. And
Okay,
then
perfect.
you might want to open up fee for service opportunities where it's appropriate. It's not appropriate at all times, but where it's appropriate, you need to demonstrate value and to sort of seek to support traditional funding streams through other methods. And that's another way where it's causing participation.
And Jordan, do you think that's part of the new normal? And anything you want to supplement Greg's comments with?
I would agree 100% with what Greg mentioned there. I would say the most obvious case that he talked about is when organizations do have an opportunity for fee for service, or it's part of their service mix, which is common to have like an element of a service offering, especially in a multi-service organization that has some fee for service. I think those scenarios make the business case for adopting technology to help provide efficiencies, which obviously makes the organization run better for everybody. It makes those arguments a lot easier, a lot more black and white, because it's a typical business case. But on the other side, if it isn't a fee for service, which is definitely the majority, with most funding models moving to an outcomes based funding rather than just a raw count, and as much as it is a trendy topic, there is still a lot of the industry that is not moved into a outcomes-based funding, but that is the trend and where it's headed. And to do that, you need good data. You need good front-end collection of data. You need sort of ironclad process to ensure that the data hygiene is good, so that when it comes time to provide those outcomes to your funders, which we all know are moving targets, you have efficient process sort of set up to do that.
I think there's a best practices layer on top of that that's really important, and technology especially today has a really important role in that. Is if we know with a given set of presenting issues and given populations, the outcomes that we're shooting for, that we're trying to affect, we know for the most part the pathways to get there. We know the things sort of to do in what sequence and what kind of frequency to maintain compliance with best practices. Mm-hmm. Technology has a big role to play in driving to those outcomes, not just demonstrating the outcomes, but driving to those outcomes through structuring the interactions with clients and structuring staff behavior, clinical behavior in the handling and the management of those cases over time to drive towards those outcomes. And what we've really seen a lot is a greater role for technology in supporting conformance to those best practices within an organization.
So, I mean, with the changing of the curve of the new normal, there would be ever evolving needs to Greg, what you just mentioned, as to, to satisfy the requirements of the funders and the donors. So I guess, technology or digital transformation is a must, would I say, or it was a must in the past. We are 10 miles ahead of that. Is that true? We should already be embracing technology if we need to do that, is the message I hear from you. Is that correct?
Well, there's a positive and a negative side. There's the positive side is it's an enabler to be able to secure additional funding and to demonstrate the value of the services that you offer, the quality of your organization, the populations that you're working with, and the effect of the work that you're doing. Like, that's clear as a bell, and those are all positive attributes. Mm-hmm. On the negative side, it's important, as Jordan mentioned really early on in this talk, it's important to do more also with the money that you have. Regardless of additional funding, your resourcing that you have needs to be allocated where it can have the best impact and used efficiently. So anything you can do to chase away waste, chase away poor client experience, like wait times, rescheduling, intake processing, intake management, reporting, collaboration, communications, information sharing, being able to monitor or manage cases, anything you can do to reduce the administrative burden on those things are mm-hmm. money that then you can reallocate to providing better services to those same clients. So I think that part, technology also has a tremendous role to play to increase or to reduce administrative waste.
No, that's, I had not thought of that part, but which is brilliant. Yes, I think Now, increasing funding on one side of the fence is great, but on the other end, we really need to weed out that inefficiencies where technology can again help. So, which is wonderful. Jordan, how about agencies that don't have Penelope? How can they manage all these expectations that Greg was talking about? Or Greg, you can even answer that.
Go ahead, Jordan.
Well, I would say, Penelope is the solution that we offer. So obviously we're biased towards that, but a lot of organizations, probably 60% of the organizations that we speak with, have a current existing, and you could call it an EHR, an ERM, a CRM, client management tool. The titles vary largely, but I mean, in layman's terms, it's a place to collect client information, program information, and ideally pull out reports and necessary data out of the back end off of that. Like a basic access database is also a really common platform that people are using. The other 40% or 30% are still on paper and pencil in some capacity. And so, again, all of those ways of collecting information and spitting out reporting are all possible. Like paper and pencil is still another way that you can still collect data and still pull out quote unquote reports, but it definitely is the least efficient out of all those options, to say the least. Right. And so I think when you marry the two, you want usability and efficiencies on the front end so that your staff have an easy to use sort of data collection tool. The workflows make sense for your organization, so you're sort of following the bouncing ball of those steps that your organization uses. And then the person or persons who are responsible for the back-end data collection, they need a space where they can understand how the data is being collected, and they can have a place to be able to pull out those reports, whether it be in their preferred format, like a raw CSV, or in an actual reporting tool like a report builder or a Tableau, something like that. Mm-hmm. Either option sort of works. So I would say that, yeah, there's all kinds of data tools out there to collect and process and report on the data. And I think it does come down to the cliche term that, we've all been saying this entire webinar, in that it's what is the most efficient? Where are you going to realize the most benefits in terms of how it fits your process?
That's true.
Like we had there's millions of examples of where technology can help with funding situations, or to help alleviate administrative burden, whether you're using one system or another. Like really, it's all about sort of, in some ways, how you are mindful of the information that you're collecting at a great cost, right? Whether it's paper or whether it's computers, you're taking a lot of resourcing to be able to do that, and it's a pain sometimes for clients to have to communicate that to you. So it's really important to use that and leverage that as much as you can. So like just simple things like, okay, organization, I remember they were looking at their data and they're like, well, there's a certain language demand that was coming at a specific site, and so they weren't able to service that in that particular sort of geographic location. So they had the evidence that this was a need, and so they went to one of their stakeholder funders and made the case for that, and it was like a kind of an easy case to make. Other ones are like time of day. So if a lot of your cancellations are happening on Friday afternoon or at certain times of day, then your staffing doesn't need to be sort of as heavy and intensive during that part. Watching through like almost like a kind of TQM or Kaizen sort of approach, where you watch sort of the bouncing ball, as Jordan says, how a client goes from initial approaching you for service or a referral coming in, how they're initially screened for appropriateness of service, acuity of service, intensity of service, the type of services that they need, and how they get sort of managed through their journey through your organization. There's so many opportunities there when you have the data and you're mindful of the data to provide a better experience for the client and their family, but also save money at the same time. And so those become really powerful I think tools for organizational refinement and thriving in this day and age, because there's going to be more pressure on funding and more pressure on organizations. One of the kind of ominous things, I don't think it's ominous, but it is something to keep in mind is that if more and more services can be delivered remotely, then whoever does the remote service delivery the best is going to win that business. Like even in the social service space. So, you know, in the same way that you can't get your hair cut, you know, somewhere else, you can provide services somewhere else now. And so I think an organization who's in where I live, Linwood, you know, for example, they've got to compete with organizations in Toronto and New York and California and wherever now, because the services can be had there. So it's going to have to make everybody raise their game and deal with competition on a different scale and a different level of quality than before. I think now people are more willing and amenable to having more of a direct role in their service. So rather than me telling you my story and you writing it down and me asking you an assessment or some set of tools, I could just do it myself. I could do it for myself, or I could do it from wherever it's a self-report is appropriate, or wherever I can just directly kind of communicate with you directly without going through intermediaries. It saves money, saves time, and it's a better experience. These kind of like disruptors are in this space right now, and I think technology has to be leveraged to be able to speak to that and to thrive in that kind of environment.
Yeah, no, wonderful. Sorry, go ahead, Jordan. Go ahead, please.
Well, I would just add on to that. I mean, it feels very similar to the trends we see, you know, the way it's discussed in something like retail, and you know, things like the term that they use is omni-channel, and I honestly see that playing the same kind of role in social services, where I don't think physical locations and in-person services are ever going to go away completely, just like I don't think in-person retail is going to go away completely, because there's an element that we all know of human interaction that just is hard to replace completely. But I do think I agree with Greg that like a big shift for a lot of the industry is going to go remote and online, and the more ahead of that curve your organization can be looking and getting, the better off you'll be, because absolutely, like Greg mentioned again, there's sort of then it becomes a globalization of the services being provided. And again, to use the retail example, if there is something like an Amazon-esque provider that can just provide online services really efficiently, they have a chance to deliver a lot more.
No, agreed. And I think the future is the next gen millennials, where the technology adoption is extremely high. I mean, the next set of clients will be more technically savvy and requesting services and options, as Greg pointed out. So, you know,
we'll be able to fax them.
That's true. So, you know, which brings us to a very important discussion is for organizations that don't have a case management platform or an EHR or EMR or even a CRM for that matter, you know, should they build or should they buy? What's the best way? What's the pros and the cons? Anyone, take it away.
Well, as someone who's built software, I would say the building part required, like you're always a prisoner of the horizon of your knowledge at any given time, right? Right? So you might think you have a good sense of what the requirements are, but the requirements, well, that may be true or not, whatever. But there's also a sense that requirements change, or requirements that you didn't see, or you miscalculated sort of how they would be operationalized in technology. And that's expensive. Those are expensive mistakes. And not only do you have to get it, there's like such a high burden to get it right the first time that, well, you got to support it. So there's technology, there's security changes in the world. There's different browsers that have different updates, and there's different expectations. It's a time-consuming, very expensive exercise to build and support software. It's so risky that it's like saying, you know, I'd like to have my own coffee every day, but I can't grow those cocoa, you know, bushes in my backyard and harvest them and then, you know, polish them and then grind them and then make it. It just doesn't make sense. I'll let the people who do that best do their part best, and I'll try to leverage it and drink it. So I think that analogy works with almost anything, but especially with software. Like you have to know what you're looking for and do a really good job of evaluating, understanding what your needs are, and understanding even your forward needs as well, and making sure you pick a right partner for that. That's critical. But to do it yourself is asking so much. It's just so risky. I can't imagine almost anything where that would be a good option. What would you say, Jordan?
Yeah, I would agree. I think your analogy is spot on. I mean, if I think of us as a company, an example, it would be like us as a software company. Yeah, exactly. Greg didn't grow the Tim Hortons.
Yeah.
It would be exactly like us as a company. Yeah, it would be like us as a software company saying we're going to build HR management software for our company. It just doesn't really make sense, even though we are a software company, but we don't really know how to build HR software. And we could probably do it, but we would probably do a very poor job, and it would cost a lot more money to build it than it would to use an off-the-shelf option like we do.
One of the biggest risks, sorry, just really is that you're really dependent on people, like specific people. You know, Susie and Fred, they're the ones who know what's going on. They're the ones who design this program, and like they better be with you for the next 10 years, or else you're in a lot of trouble. So
yeah.
There's like such risk involved in this endeavor that even the people who decide that I'm going to go develop my own software, they might not be around to pay the full cost of accountability as it plays through life. So
yeah, and we run into that like hundreds and hundreds of times every year, speaking with organizations around the world who have done that route. And yeah, to your point, people leaving is the biggest risk, or one of the top 3 biggest risks, I would say, for sure. So I would say that, yeah, I don't think there's much more I could add to your point, Greg. I think it hits it right on the head.
No, that's wonderful. I mean, I didn't realize all the pain points or the challenges in building up your own software. On the face of it, it seems fairly simple that you have a set of requirements and off you go to the drawing board, build it up and move on. But apparently, I haven't looked deep enough to realize what else could be ongoing. So let's presume that, we made a case that buying is an easier option, especially for organizations that are within this very sector of social services and being a nonprofit. Jordan, let's say some organization or agency is adopting this software or a piece of technology. Why are the first steps so very critical?
I think the first steps are really critical when you're examining software, because you need to do a pretty in-depth needs analysis. Like, what do you really need and what is a fit for it? And like I said at the beginning, that's where we spend the majority of our time, like myself and my team, is really needs analysis. And we typically do it with like our solution open on the screen. Mm-hmm. So we can really walk through in like a live example your process, or like a prospective agency's process, and how it would marry up to ours and Penelope to determine if there's a fit. Because again, like my previous example of SaaS software is like this renewing relationship. It is sounding cliche as well, but it is like a first date in that the fit has to go both ways. Mm-hmm. We don't succeed as a company if our software solution isn't a fit, and vice versa. So it really is a two-way fit that we're looking for, and both sides are sort of there to determine if it is a fit. So I would say that upfront needs analysis and sort of breakdown of an organization's process is the most critical. And then the second one, to Greg's point, is you also want to make sure that you do have the staff on hand to manage this. Using a system like Penelope as an example, which is an off-the-shelf solution, it's built to not require a lot of in-house technology help. But you do need somebody to still manage the system from a system administrator standpoint. So those are more resources that we're leaned on quite a bit, where people are saying, what kind of people should I have on my team to help roll this out and maintain it? And we have resources that show this is the kind of people you should have, and the kind of strengths that they ideally should have. And again, it's not a heavy lift, but it's not nothing.
I think just to add to those points, there's like 2 other important aspects. One is there's a set of kind of functional requirements and non-functional requirements. And I think it's really important for organizations to be attuned to the non-functional ones as well, that are really going to be important for them moving forward, and to be able to prioritize them. So when they're evaluating software, you could sort of have a matrix to be able to understand and evaluate how it meets those needs or not. And that would apply to the functional ones as well. But as it relates to the functional ones, you have to for sure have a group that is coming up and informing your decision making that is right from the people on the ground in the field at the coal face working with clients on a day-to-day basis, right through to the managers, the admin staff, the executive. Like, we have to have inputs from all of those people to be able to understand what the requirements are. But I think it's really important not to just say, okay, let's replace whatever we have today. That's a perfect opportunity for you to say, okay, where can we create improvements? Where can we kind of reduce some of the idiosyncrasies or things that don't make sense about what we're doing today? So it's important to bring that to that sense of innovation and improvement to your thinking as well, and then look for a software that will be able to meet those points as well. Because lots of times, if you're moving from one system to another, what's the point of just replacing it on a point-to-point basis? You're selling yourself short in that process. You know what I mean?
Right. No,
Yeah.
wonderful. Great discussion. Sorry, Jordan, I thought you were going to add something, but just wanted to give you a sense of time. We have about 10 minutes left for the conversation. Jordan, wanted to do a sanity check. Out of the questions received, do you want to take any one of them? Or do you think I should pick up the one?
The only question I would answer here would be around how could somebody learn more? And that one's a pretty easy one to answer. So I would say that if you do want to learn more about Penelope specifically, because I know originally we had allocated some time to go through Penelope reporting and sort of look at how we do it. And again, the discussion here was great. So happy to sort of pick that up offline with people individually, and feel free to send me an email directly, and we can make sure you get to the right person in your territory. And it doesn't have to be an in-depth look at Penelope. It can be a simple Q&A with a system and some reporting options open.
Oh, no, this is wonderful. I think that's a great opportunity and an offer. And I think all the participants or those who are watching or listening to this discussion should take advantage of that. And I believe there's no obligation to have that conversation or sanity check with you, testing of their environment and doing their assessment. I hope there is no obligation, Jordan, from your team on that.
Nope, not at all.
Okay.
Yeah, that's what we're here for.
Okay, so the follow-up to that question is, can we talk to one of your existing implemented Penelope? Is it possible?
Yeah, absolutely. I mean, we facilitate referral calls with people sort of in the same geographical space or industry or vertical. So if the time is right and somebody wants to speak with somebody about their experience with Penelope or Athena in general, yeah, we can absolutely facilitate that.
Perfect. That's awesome. So before we part, Greg, any parting thoughts or comments that you would like to share with the audience in terms of the trends, or even Jordan, for your matter? I won't put any one of you on the spot. Any closing remarks in terms of the discussion today? Is the new normal, the funding patterns, achieving efficiencies and reducing redundancies within the organizations? Anything that you might have missed that you want to capture now?
I'd say that if you've been kind of sitting on the fence for a while and wondering, is it the right time to deploy technology to bring your agency in alignment with the new realities, or to achieve sort of your ambitions with your clients, for your stakeholders and the communities that you serve, like, now is the time. It's such a disruption going on across the entire world. We're seeing this in every jurisdiction that we work with. So, like, now is the time, I think, to take it seriously. And like, as Jordan, just to tie back to what Jordan mentioned earlier, this is not an expense issue. This is an investment issue that will enable you and position you in a position to be able to thrive in this next world that's unfolding before us.
Yeah, no, thank you so much, gentlemen, for your valuable time and incredible insights. Thank you so much. We have come to the end of our time for today. So stay safe, everyone, and thank you once again.